Yeah, so thanks so much, PMD Alliance. Good morning, everyone, or good afternoon or good evening, depending on where you are. And for those who are watching this later, thank you for watching. And I think we're just excited to continue to chat around issues that affect people living with Parkinson's and kind of make a bit of an international sort of catch all kind of everyone under the sun who has ideas to help people living with Parkinson's, I think has been my thing. So I've been pretty active on Twitter for the last couple of years and just joined actually in the last year and a half. And I've just been excited to hear about the work that people are doing all over the world to champion for different causes, even within the umbrella of things that affect Parkinson's patients. So I managed to meet Shafaq, who is a real bright light in spirit through Twitter, and had a chat with her and wanted to bring some of her spark and energy to our audience here in the US, and hopefully teach us a little bit about her work and advocacy, and also learn about some cool things. She's actually a dentist from the UK and has had a long experience with working with different sorts of populations around dental health. Some of you know that I and Professor Chowdhury at the Movement Disorder Society meeting just started this wellness task force. And under the sort of umbrella of wellness, it includes things like meeting people where they are from a cultural context, understanding the person with Parkinson's, not just as, a cookie cutter person, but just understanding holistically kind of who that person is. If it's a woman that looks like me who, has kids and has brown skin and is a doctor living in North America, it may be a very different experience than someone living in Africa, than someone living in the UK, and understanding those sort of geography, what our resources are, who we are, what our religious beliefs are, everything really can affect how we live with Parkinson's or any chronic disease. So I think it is something that we haven't really thought about. So that cultural context is something that we'll be talking about a little bit today. In terms of the wellness task force, we're talking about things like proactive lifestyle choices, things that can keep us all healthy, things like exercise, diet, mind-body approaches, which include spirituality, as well as sleep and social connection, which is something that I've been really interested in, and also finding meaning and purpose. And so we'll talk a little bit about that and Shafaq's advocacy work. And then also we've been talking not just about Parkinson's as a motor disease, but also things that affect the whole body of a Parkinson's patient. So that includes various types of health. And so dental health, even though I'm not the biggest fan of going to the dentist, is something that actually can affect health in general. It's a huge sort of risk factor if you have poor dental health for a number of medical problems, actually. We kind of forget that. And so it's something that Shafaq will teach us a little bit about. And also in that umbrella includes things like bone health, gut health, mental health, which we've been spending a lot of time talking about, but also things like even vision and hearing, which we don't really think about very much, but, getting these tests, going in to see your doctor for basic hearing checks, basic vision checks, making sure you can see okay, and also going to the dentist to check in about your teeth, are actually huge things that can affect your global health as well. So we'll spend a little bit of time talking about all of these things. So Shafaq, maybe you can tell us a little bit about where you live, and a little bit about, sort of your journey, sort of with Parkinson's disease thus far.
Okay, so hello, everybody. It's nice to virtually meet you all. I'm from England, as you might be able to tell from my accent. I live in a lovely county called Yorkshire, the biggest county in England. It's getting rather autumnal here right now, so forgive the big fluffy jumper. I am 43 years old at the moment, and I was diagnosed at the age of 40 in 2019, July 2019, and was probably symptomatic for about at least 7-8 years prior, if not more. I am a dentist, as Indu said. I've been working as a dentist for 20 years now. And I don't know where the time's gone. It doesn't feel like 20 years. And actually, I love my job. It is very sad to say. Well, I don't think it's sad to say you enjoy your work, but people find it very amusing that I enjoy looking at teeth so much. But it's not just looking at teeth. I do feel like Indu feels passionately like, neurology is a part of the whole. For me, dentistry is a part of the whole as well. It's like the mouth is the gateway to the body, and I can tell so many things from people by looking at them mouth, but doing my dental exam, I might look at people's hands and look at their nails and see, do they bite their nails, and I'll figure out things just by looking at their mouth. And I do try and treat my patient as a whole, and that's actually what I enjoy doing the most. I work a lot with phobic patients, and phobic patients is great. You build up such a rapport with them, and I love the fact that I've lived all over England, because my husband is a surgeon, and in England you have, well, I'm sure it's the same in the States, you have to go through different rotations. So we've hopped around the country as he's done different rotations in different areas to get to his final point of being consultant or attending. So in different areas that I've worked, I've ended up acquiring patients who followed me around the country to make sure they can still see me. And just today I had one such patient in, actually, who was like, I've been seeing Shaf for years, I followed her around the country, and it's really lovely because you do build up that rapport with patients. And one of the things I do with them is a lot of breathing exercises, but also IV sedation. And that's me as a dentist, and a dentist with PD, and a person with PD.
That's amazing. Well, maybe you mentioned something that kind of struck me. You said that you had symptoms for 7 or 8 years before you got diagnosed with Parkinson's. And I know that people who look like us are not the prototypic kind of person that comes to mind when we think about who gets Parkinson's. What was the reason that you think you had symptoms for 7 or 8 years before you got to the diagnosis? Was there a delay because of disease awareness issues?
There was definitely a delay. One other thing, there was disease awareness was definitely a factor, but also my children were young at the time, so I put symptoms down to fatigue due to being a mum of young children and working. I was working 4 days at the time, and it's although however much one loves work, their occupation, it is tiring. So there was that, and also there's very much I'm personally within myself, and I think within a lot of South Asian culture as well, there's quite very much a stoic mentality. You just crack on. You don't stop, and you don't, you don't have time to be perceived weak in any way, type thing. So it was very much that was very much and it's very much a surgeon attitude as well. Dentists are like that anyway in England. So we just try and crack on. So I think it was a multifactorial, but definitely the perception and the awareness of the fact. I despite being quite well, I think I'm reasonably well read anyway, I didn't have I wasn't aware that Parkinson's could occur in relatively young Asian women as well, or South Asian women, and to be honest, it really came as a shock to me. And it took me a long time because I had no idea about the symptoms, and I didn't put them all together in one box. I thought they were all different things. So my tiredness was one thing, me tripping over was, muscle problems or something like that. And my pain was, straining my muscles, and my posture was bad at work. I had a reason for everything, but it didn't all come in the one box of Parkinson's disease. And it took a number of years, like I said, several years, for me to clump it all together in one box. And it was only when things became quite obvious, like now I'm looking at myself on the screen and I'm noticing that I'm only gesturing with my left hand because it's in the evening here, and I'm running a little bit low. But my husband noticed I was using one hand to gesture. I was using my left hand to eat rather than my right hand. So it was only when things were quite obvious that actually we put all the signs and symptoms into one box, and we thought, it was actually him, my husband, that actually said it fits the young onset Parkinson's box. And I was shocked, to say the least.
Yeah, I mean, I think that is sort of one of the difficult things about Parkinson's, is that it can present with a lot of non-motor issues that are very subtle, and there are ways to sort of think it's just this or that, and sort of the mind, it's hard to put it all together. And then I think when we don't see images that look like us as people who can get Parkinson's, and literally it could be anyone, right, in the world that we've met now, of all ages almost, and all skin colors and anywhere. It really is something that I think we need to do better to educate doctors around, because there's definitely this mentality of having this older, Caucasian man with certain motor symptoms as the image. So I think that that really does play a factor in delaying things.
That is, sorry.
Go ahead.
I was just going to say that's why it's so important that we do advocacy work where people become aware of the fact that Parkinson's can affect anyone, any age, any gender, and any skin color. It's very important, and we need to redraw that image.
Absolutely, absolutely. And then I think you're right. Like, I think a lot of people, and a lot of women, especially who are working and trying to balance families, they end up just sort of maybe in a bit of denial, maybe just sort of hoping things will get better, and sort of pushing through, and often tolerating a lot of things. And then finally, when one presents to the doctor, it is going on for a while, and it has been, getting worse. And there are sort of things that are kind of sometimes relatively obvious, and you look back and you put it all together. So I think that's
exactly
sort of,
hindsight is 2020, huh?
Yes, absolutely. Your story resonates, I think, probably with a lot of folks out there. So, well, I think that your work in dental phobia is also so interesting. I think that we had talked a little bit about how the mind and the body are very connected, and how we can rely sometimes on certain practices also to sort of help in anxious situations and in phobic situations. So I think that's really a very interesting piece of what I'd like to also talk to you about, Shafaq. So maybe we can sort of talk maybe around, maybe first we'll talk a little bit about your thoughts on teeth health in general, and maybe bring in some of your history of going. I think you told me that you went sometimes to even educate in people's homes and things like that, who are quite sick with other diseases sort of in your path. So maybe just a little bit sort of about your sense of why teeth matter, and what kinds of practical things we can kind of do for all of us, and specifically in Parkinson's patients.
Okay, so the home visits you're referring to, it's literally in the UK we call them, it's domiciliary care visits. So most dentists will at some point have to go visit either care homes or visit people who are for some reason not able to leave their home. Either they've been in an accident and they're not very mobile, or they've got a chronic condition which means that they which has progressed such that they can't leave the home, or it's too difficult for them to access the dental practice. And this is one of the things which is a hindrance in people with Parkinson's accessing the dentist. It's access. So in the UK, we've really tried to overcome that by making sure we have facilities available on ground floors, and where they aren't available on ground floors, we've installed lifts and things like that. But that's just one problem. Going back to domiciliary care, when I did care home visits, one of the things I really noticed, and I treated a lot of patients with chronic conditions, some with Parkinson's, some with Alzheimer's, some, I don't even remember all of them all, but many of them had problems with their teeth, because teeth is something one often gets neglected by healthcare professionals, but not deliberately. But you think of teeth, it just seems like a little thing. When there's brain tumors going on, or there's chronic conditions, which demand much more attention, then you end up focusing on them. But actually, when I remember a patient not long ago, I went to go visit them in a care home, and I was so sad because she had Parkinson's, and it was quite progressed, and she wasn't able to communicate properly, but she was in a lot of pain, and there wasn't a lot I could do for her because she couldn't come to the practice, and there's only so much I can do with the dental materials I could take to the home. And I felt very sad because it's entirely preventable if we educate our patients and educate the people who are the caregivers, and educate in the UK we have Parkinson's nurses, educate them to be able to provide more advice on how to prevent tooth decay occurring. I think it would be so much better for patients further on. Patients with Parkinson's across the board, there's unanimous verdict, we have poorer oral health. Okay, they might, I'd like to think I don't, but I'm a dentist. How many dentists are there that, it's a shame, and it doesn't need to be thus. little things like implementing the use of, you know, an electric toothbrush, or what I used to do for some of my patients was get putty, dental putty, and thicken up the handles of the toothbrushes so that it was easier to hold for my patients. Little things like that make big differences. When you have a whole host of other pain and other problems going on from conditions such as Parkinson's disease, you don't want to be dealing with toothache, which can be horrible. Any ache in this part of your body hurts so much more than elsewhere, and is really important. I think I might be overstating it, maybe because I feel passionately about it as a dentist, but toothache is horrible when you have other things going on in your body. Toothache is preventable, and if you can prevent it, I want to get the message out there to prevent it.
Absolutely. So it sounds like electric toothbrushes, if possible. Everyone should be using electric toothbrushes, do you think? Is that like the new standard of?
I think everyone should be using an electric toothbrush. And in the UK, I'm actually pushing to try and make them available in a subsidized form for Parkinson's patients. So yes, electric toothbrushes, but there's also these things called water flossers, which make a lot of mess, but they're brilliant because you know what, flossing, when you're tired at the end of the day, even as good as I am at flossing, it's difficult for me to floss at the end of the day when I'm tired. So a water flosser is really good. And definitely an electric toothbrush and mouthwash, you know, the usual things, adjuncts that one would use as well. Very important. And
to break that down, because I don't know, I mean, in the certain countries in the world, people may not have access to dentists, really. I think a lot of it's out of pocket and it is expensive. So, so maybe, Shafaq, we can just spend some time. So basically just teach us about a daily routine for a newly diagnosed Parkinson's patient, let's say, if they have access to things, what would, and maybe, I don't know enough about a water floss, so maybe teach us a little bit about that too.
Okay, so one thing with Parkinson's which we don't realize is how much we compensate as individuals for our gradual loss of motor function. By motor function, I mean our physical ability. So we might not have realized that slowly over time where our brushing is becoming less and less effective. By implementing the use of an electric toothbrush, as soon as we know we have Parkinson's, we're sort of mitigating that effect. And that's really important because in order to reduce the bacterial load in our mouth, we need to be able to brush effectively, because dental decay is caused by bacteria producing acid, or acid producing bacteria, which then causes demineralization of the enamel on our teeth. So we want to reduce the load of that bacteria as much as possible and as effectively as possible. And using an electric toothbrush is I recommend it to all my patients, every single one without fail. But patients who have something like Parkinson's disease or anything else which reduces their motor ability, I definitely wholly recommend it too. Now, water flossers come in various guises, and one of the most popular ones is called Waterpick, and it's literally like, it's a bit like a toothbrush, but at the top it has a pointy nozzle, and the bottom of the electric toothbrush is filled with water. And you literally, it's quite fun. It's like a mini water pistol, and you just press a button and it squirts the water between the gaps in your teeth. Although you think, you know, you haven't got many gaps in your teeth, but actually when you squirt the water between your teeth, you know, you'll be amazed at how clean it feels afterwards. It is amazing. So anyone who has Parkinson's, I'll definitely recommend that you brush your teeth and get up in the morning, brush your teeth, use a water flosser. And then in the UK, we tend to teach brush your teeth before breakfast. That's a contentious issue around the world, but that's what we tend to teach. So yeah, and then after breakfast, we tend to say go and do your fluoride mouthwash. I would say use fluoridated products all the time, primarily because it helps favor the body's fight against dental decay. And then yeah.
No, go ahead.
Yeah,
so
and then
every meal you would you say rinse your mouth out after every meal as well, or?
That's what I was gonna, yeah. I would definitely say if you've got the time and you're at home, I would definitely say do mouthwash at least after every single meal. And if you can do the water flosser, it's brilliant, honestly. It's a bit messy, so you won't want to be doing it in the, you know, restrooms. but at least a mouthwash, and if you can, floss as well, then floss too. And you should be brushing at least twice a day, and at least twice a day.
So there's some comments here. I'm just going to start to read some of them. And it looks like our Andrea here is a big fan of using the water pick. I read,
Right.
so that's exciting. Let's see. So Paula writes that she has a dental phobia, which makes her symptoms exacerbated. What would you do for a patient? We'll talk about that in a minute. It says here, do you suggest a silver psyllin containing toothpaste for people with PD? What about probiotic enriched toothpaste to fight mouth bacteria? I don't know enough about silver psyllin. Have you heard of that?
No.
Okay. I'm not sure what that is, but maybe Faye, you can write a little bit more about that. But what about probiotic enriched toothpastes? Do you know much about? I mean, I'm sure that
it's not something which is made. It's not something which has made its way to the UK yet. Probiotic enriched toothpaste. So I couldn't comment to that, to be honest with you. Probiotics are brilliant. Full stop for people with PD. So yeah.
And then Savella writes that she recently found out that her US dental insurance covers a little bit more than usual because she has PD. So it sounds like people out there should look into what their dental insurance may cover and tell them that they have Parkinson's, and maybe that will allow them to get more resources as well. There's also been a comment by Andrea that she uses her water pick in the shower, which is cute. And they make cordless ones now, it looks like. And then maybe Andrea can tell us a little bit about her water pick experience. That's kind of cute. I don't have one, so I'm gonna have to get one.
It's good to use it in the shower.
Okay, that's cute.
Messy.
So Dave writes that he also uses it to flush excess wax out of his ears. Okay. And then silver psyllin is a detoxification agent made like charcoal. So I have seen some charcoal toothpaste as well.
It's a big thing nowadays. Charcoal, activated charcoal pastes and things like that. The clinical base, evidence for that and how useful it is the verdict still out there. So I would like to think it wouldn't do any harm, but because the research is still being done on such products, I couldn't recommend it either way.
Sure. So it sounds like what toothpaste would you recommend in general? You don't have to necessarily say a brand, but what kind of, you said fluoridated?
Yeah, fluoridated toothpaste, definitely. There are some toothpastes out there which aren't fluoridated, but I think fluoride gives you that extra push in making sure your mouth's able to fight bacteria and stop demineralization occur. And it's important when you have Parkinson's, especially if your symptoms have regressed somewhat. I mean, when I'm tired, my jaw, it does a little tremor thing. And that's difficult when you're a dentist and your patient's jaw is doing that. So you want to try and minimize your visits to the dentist. So yeah, do everything you can. Use fluoride toothpaste because that helps you fight tooth decay. Use fluoride mouthwash because they will help you fight tooth decay, because you don't really want to have treatment at the dentist unless you need to. As nice as us dentists are, I can appreciate you don't want to always be exposed to our treatment methods, even though we're lovely.
And the truth is that the doctors we don't know much about teeth at all. I know when before I went to get pregnant with my, I want to say third child, I wanted to make sure I didn't have any active infections. And my dentist was like, how many days in the 4 years of medical school did they teach you about teeth? Like, how many lectures did you guys have? And I was like, I couldn't remember, honestly, more than half a lecture, if any. I remember looking at, we had to look at anatomy and just the teeth then, but it was part of the skull and it wasn't, anything that was really emphasized. So relying on your doctor, unfortunately, to look in your mouth and tell you when you need to go to the dentist is not brilliant. And many of us are also not the best at going to dentists ourselves. I'll just be honest about that. So I think we just need to really turn a new page and realize that this is part of the body, as Shafaq was saying, and it's a very accessible, important part of the body that is overlooked by your doctor. I'm just going to own that right now. So Professor Chapter are trying to do better, to sort of raise awareness. But I think we're trying to push for, at diagnosis, patients getting screened for vision and hearing, but even, trying to push for a dental visit at that time would be a good thing, I think, as a start, so that people can kind of reestablish care. And I know with the pandemic, many people have kind of gotten off of their regular dental visit schedule. So urging people to get back out there. So Barbara writes, question with my severe dyskinesias, I clench my neck jaw muscles leading to TMJ pain, headaches, and teeth pain. Will wearing a mouth guard at night help with these daytime symptoms? Do you have a comment on that, Shafaq?
Yeah, one of them is that yes, getting a mouth guard which is made properly could well help. You need to talk to your dentist about that properly, because it depends when you're grinding, how you're grinding, and your actual bite as well. Definitely helps. I mean, I don't know, maybe you could advise about Botox for clenching and things like that, because we do use that quite a lot in the UK. Botox for clenching, and it helps relax the TMJ a lot, the muscles around the TMJ a lot. So I don't know whether that's something you do in the US, but that's something you could look into. We would definitely look at that.
Yeah. So I think from a motor standpoint for Parkinson's, making sure that your motor symptoms are optimally treated. So you want to get on a decent amount of, Parkinson dopamine replacement. Certainly, if you have overnight symptoms that are causing jaw clenching, seeing if there's a long-acting preparation that could be given at bedtime into the morning to see if we can, help with the motor symptoms of stiffness and slowness. Agree that I think sometimes focal Botox to these muscles can be helpful in some occasions to help with that grinding and teeth issues. And I think looking into the dental mouth guard is also helpful for some people. Somebody writes here, due to flaccid facial muscles, I sleep with my mouth with open mouth breathing, causing very dry mouth. I have even resorted to taping my mouth closed. Does mouth breathing cause cavities? Yeah,
it can contribute to cavities. You can actually get a type of mouth guard made, which helps hold your bottom and top jaw together, not together so that they're clenching, but together at the right distance apart they should be. And again, speak to your dentist about that, because it's a really easy way, and it helps with snoring, and it helps with people that sleep with their mouth open, because when your mouth is desiccated, and this is another problem actually people with Parkinson's have, because a lot of medications we take cause xerostomia, which is dry mouth. And one of the main functions of saliva is to lubricate the mouth and keep the bacteria levels low. So if we have a dry mouth, our natural antibacterial agent, which is saliva, and washing agent of our mouth, which is saliva, isn't there. So therefore, naturally, more plaque builds up, more bacteria builds up, more cavities occur.
Yeah, and that can definitely, sometimes also sleeping with something to make the air more humid can be a little bit helpful too. Like a humidifier can help. But certainly opening your mouth and having that open the whole night long will dry your mouth and can worsen cavities. We're also a little bit careful. Some patients have asked us if there are medicines that we can give to stop drooling. And what happens with Parkinson's patients, and Chuck, I'd love to hear your ideas too, is that it's not that we're making too much saliva, it's just that we're not constantly swallowing saliva. Like even when I'm talking right now, I have to swallow saliva. We're all doing this just sort of naturally. That gets slowed, and so people pool secretions. Sometimes also if their head positions forward, sometimes those secretions can come out. So often we're a little bit careful with trying to dry the secretions, because as Shafaq just mentioned, those are the things, the saliva is the thing that actually keeps your teeth healthy and keeps bugs from happening. If we start drying saliva, sometimes people can get worse dental issues and cavities. And also sometimes then we worry that if you do get bad infections in the mouth, this can translate to pain, as Shafaq was saying, and that's not ever fun. And then a lot of dental work that's often, preventable if we just get ahead of it, that can be expensive and painful and stressful, but also can lead to the overall inflammation anywhere in your body. Sometimes can make people, if you have an infection, like a urine infection or a dental infection, it can make Parkinson's symptoms, both motor, non-motor, mental health, even like cognition. People can get confused even Absolutely. From a bad dental problem, and it can take a while, even after we've treated it, to really let that settle back down. So we really want to get ahead of that if we can. And then also people have asked about are there medicines that we can give to dry the mouth for people with drooling? And a lot of those medicines that dry the mouth can actually cause confusion in and of themselves. So we're a little bit careful with trying to dry the mouth because of these issues. And as Shafaq was saying, some of the Parkinson's medicines can cause dryness, but also bladder medicines and other medicines that we use can cause a lot of mouth dryness. So just really look at the list of medicines that you have. If you're suddenly having a lot of dental issues and dry mouth, it's important to check in about the pills that you might be taking. Even sometimes over-the-counter pills can make the mouth dry. And so maybe you could comment a little bit on that dry mouth issue. Are there other things that people can do to help with dry mouth?
Yeah, so with dry mouth, you can get well, there's a few of the things, easy things you can do are always keep a bottle of mineral water with you so that you can sip on water. Sugar-free chewing gum and sugar-free, cough drops or things like that are brilliant to try and keep one's saliva flow going. But if all of those yield not significant results for you, then you can also see your clinician, your dental clinician, about possibly getting prescribed alternatives to saliva. So these are like drops often that one puts in one's mouth, and there's lots of different varieties and not the same ones suit everybody, so you might have to go through a few before you find the one which suits you particularly, but they are there and they can be prescribed if necessary as well. But first, always go for simple solutions first of all. So keep water nearby, sugar-free gum and sugar-free cough drops or sweets, sucking sweets that you can just keep one in your mouth.
Yeah. So with those sweets, I think, the sugar-free ones are important. We don't want to put more sugar.
Yes, sugar-free one is very important.
Yeah. And there are lots of yummy flavors. I had a patient who brought me a bag and there were actually some great ones. So experiment if you don't love them. Be careful though, if people aren't super awake or have the tendency to somehow go between sleeping and awaking, you want to make sure that if somebody has something like a gum or a sweet in their mouth, that they're not going to somehow choke on it if they fall asleep or something like that. So that's, obviously, make sure that you're awake and you're able to swallow it and you get it out of your mouth if you are going to fall asleep. So there's been so many comments here. Wow, this is like, yes, so there's some thoughts about going to the dentist with dyskinesia and that the dentist is frustrated because they can't hold the mouth still. So that might be some ideas there, and maybe even teaching us a little bit, maybe some of the stuff that works for the phobias may even help with calming dyskinesia a little bit. Maybe we can segue a little bit to that, Shafaq.
That sounds like a plan to me. So one of the main problems actually is, lack of dentist understanding about how to handle patients with Parkinson's. And dyskinesias can be very frustrating for the dentist, but there's no reason why they should be expressing that frustration to the patient. It shouldn't be communicated to you. And if it is communicated to you, then you must not ever take it as a reflection of you. It's that dentist, and they just need to take a breath and settle down. But what you can do as the patient is use mindfulness to try and calm your dyskinesias down. I know you might be thinking, oh my gosh, what's Shafaq talking about? Actually, it works, because when I first went back to work after I had a period of time out during the COVID, and it was first time me going back to work with my, post-diagnosis, I was doing work again, and actually breathing exercises helped immensely. So, I mean, there's a few techniques you can use. The box technique, which one of my friends taught me, is brilliant. So you breathe in, for 6 and out for 6, and you hold your breath actually for a little while, and then you breathe out again. And it's brilliant. So I would actually really recommend looking at breathing techniques, and different breathing techniques will work for different people, but it grounds you. And you need things like that to ground you when your dyskinesias are playing up, when your nerves are playing up. Use your breathing techniques, use your grounding techniques. And it might sound like mumbo jumbo, but it isn't, I promise you. And please, 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 if a dentist ever makes you feel uncomfortable, go find another clinician. Not every clinician is suited to everyone. That's not, people have different personalities. Just find someone else, because someone else will be suited to you. And if you're in the UK, I'd say come and see me, but I don't think you are.
That's very cute. So you were saying that when you went back to work, you were having a little bit of your own anxiety, and then you were.
Yeah, it wasn't disconnected. It was just my tremor isn't always very well controlled anyway with medications. So it was re-emerging sometimes at awkward moments. But now, fortunately, it's all it's all settled down, and breathing, honestly, grounding myself through breathing really works.
Yeah, I mean, I think this is just the human way. So Dr. Subramanian right here had an MRI on her neck for the first time. And I'm also in my 40s and have ordered MRIs for people for almost 25 years as in training in medicine and beyond. And I was in the scanner and was about to have a panic attack in the place that I work. So I was in the scanner and I had this vision of me having a panic attack and having to stop the MRI and then pulling me out and having like half the hospital come and visit me, watching me have this panic attack. And so I do teach some breathing stuff. I do teach yoga and some mindfulness, and have relied on some of these practices, for a long time. And so the more you practice, the more accessible this stuff will be. And I think it's absolutely very helpful and worked for me as well. So I was able to literally rely on breathing. That's what I did as well in the scanner at the moment, just sort of, focused on my breath, prolonged the exhales often are really going to help relax you. So as Shafaq said, sort of breathe, you can count up to, 4 or 5, and the in-breath, and then have a deep exhale, sometimes 6, 7, counts, and then wait at the bottom of that exhale. And sort of just chill out. And that slowing of the breath and slowing into that long exhale and pausing is actually what's going to invoke a relaxation response, really take you out of sort of that anxious, panicky situation and kind of get you into sort of more of this calm space. And we're all human. We all have this. So I just taught you about my little experience as well. And by the end of that scan, I was so relaxed that I almost fell asleep, and they were like poking me awake. So these things do work. And the more you try them, it's very hard to try them for the first time when you're in the midst of a panic attack or something. But I think, trying to do some of these on a regular basis so that they're accessible to you.
I use them with patients. A lot of my patients I use them with.
So is that what you mostly do with the phobic patients, Shafaq, is the breathing? Or teach us a little bit. So let's say we had a patient, somebody up on the chat here said that they're phobic. So let's say you've had someone who's had a bad experience, like me, with a dental procedure, and kind of comes in, is already stressed out from the get-go, and you notice that. So talk us through a couple of things that may be helpful.
The first thing I would be is I would try and do is understand where their phobia is coming from. So for me, when it comes to dissecting a phobia, it's literally dissecting the phobia. One has to sit down and understand that make the patient understand you're on their side, on their team. You won't do anything that will make them feel uncomfortable. I don't even pick up a mirror until they give me permission. So first of all, I talk to them about where their phobia started, and we try and pick it out, what the anxiety inducing parts of it are, and we work around them. We gradually introduce. So if, for example, a common anxiety thing with a lot of my patients is tooth extractions. And another one is injections, the needle phobia. So I build up to it. So one day I might just look in the mouth and literally spend 15 minutes just talking to them about the phobia, reassuring them that I won't be doing what previously has occurred to them to cause them anxiety. And I might just look in the mouth, and then I'll get them back again. And we build up bit by bit. So it's a desensitization process almost. That works with a lot of my patients. And the other thing which works with a lot of my patients is actually music. Music. I sing, I hum when I'm working. So that sometimes helps them. Some of my patients actually say to me, can you just hum along, and it will help me. So that works with some of my patients. And if all else fails and behavioral techniques don't work, and I'm big on behavioral techniques, and they often do work, then I resort to intravenous sedation, but you have to not have a needle phobia for that, obviously. So yeah, there's a various techniques I use. Self-hypnosis is what I do as well, like to gradually from the mouth, from the head down, getting people to relax, literally from shoulders dropping, each vertebra, just relaxing it, and sitting, getting them to sit and breathe properly. It works a lot of the time, not as much as I'd like it to, but we're dentists, we're trying. We've got a bad rep. It's a hard fight.
So you literally have the patient sitting in the chair, and you'll say, Mrs. Smith, okay, we're going to start at your forehead. Let's just try to relax the muscles here, and then sort of let's drop the shoulders down, and you're breathing at the same time, and then sort of work throughout the body. And I think one thing that I think people don't realize, and I'm the same, is how much tension we tend, when we get anxious, how much sort of
it's the jaw to the shoulders I find is the most. So literally, and actually being a dentist, I can actually, you know, I'll put my hands on their forehead and just stroke their forehead, just hair it a bit, and that helps. And I read each person and I see where they're feeling the tension. I put my hand on their shoulders, or I might hold their hand, you know, and if anxiety often presents in, you know, patients tapping their feet or just not sitting still, and so I'll often try and help them stay still, because that suddenly releases the tension. You have to work with each individual, and that's where the thing is, and that's where I think in Parkinson's and tooth related things, we need to learn that each patient is an individual, and we need to look at those individualities, whether it be that a 16-year-old, you know, young person who has unfortunately been diagnosed, or a 66-year-old person, whether it's male or they're female or they're, you know, white, brown, black, whatever color they might be. Each person's an individual, and whether it be the teeth or the brain, those individual nuances are going to tailor one's treatment for them. And that's what you need to. So with some patients, I know for a fact they're going to not be able to, behavioral techniques will not work, and we'll go straight to IV, and then we'll work backwards. I'll wean them off of the IV sedation. And with others, you know, I can go straight into behavioral techniques. It's very much wanting to help the individual. And as soon as my patients understand that that's what I want to do, it's about helping the individual, that they begin to relax.
Yeah, I think when there's a human connection of a feeling that people are being supported and met kind of where they are, and that you're there to help, you know, I think that can be very helpful. I think sometimes when we get busy in our schedules, you know, we sort of, you know, there's sort of too much that's happening, right? It's like, I have to do this filling and I have to get to the next patient. And, you know, there's sort of this,
pick my children up from school.
There's a pressure that we have to kind of get everything done. So I think that idea of just bite-sized pieces, if it's not an emergency, and sort of getting, you know, sort of used to the idea and maybe coming back. And if it is some more time, maybe a practical tip might be just to schedule extra time on the dentist's schedule, or with somebody else in the room, to help sort of with some of these things, so that it's not a rush because the person needs to get to a different room with the next patient waiting. Sometimes it's just sort of a timing thing. So I think that is kind of a nice thing. And you were saying about people who are moving their feet a lot and stuff, that they're sort of moving too much. So you're able to get them to stay. How do you teach them how to stay still? Can you tell me about that?
I don't know. To be honest, we go through the breathing exercises and work our way down from the shoulders, and I'll just say, keep moving your feet, honey, and your adrenaline is going to keep kicking, and you know, and I literally just say, come on, try and keep that foot still, concentrate on your breathing. I just distract them. If they're distracted from that, then they'll begin to stop. Equally, sometimes, you know, when patients are finding difficulty having dental impressions, I have to get them to wiggle their toes to distract them from what's going on in their mouth. But most of the time, I'm trying to get them to stop wriggling, kicking their legs about.
Yeah, so I think, again, getting out of the body part that's sort of in that phase of whatever, be it tight or overly moving or whatever, I think moving a different part of the body, or getting your focus on a different part of your body can actually be, and as you were mentioning, the grounding. So I think, you know, putting attention into your feet, or your whatever's touching the chair at the time, using the breath for grounding, or as you were mentioning, humming. That sounds kind of interesting. So you have the patient hum along with you? And that doesn't distract.
It's so funny. I didn't realize that I hummed that much, but my patients actually saying, "Oh, Shafaq, can you put those songs that you always sing along to, because it makes me feel better."
Okay, so you have a playlist that plays in the back, and then you hum along?
I don't actually have a playlist. It's just the radio going, but they must, maybe, you know, when the same radio comes on again and again, same song, sorry, comes on the radio again and again and again. So yeah, they just, Yeah, apparently my nurse says I do have a favorite song or two, and then she gets fed up of it. And sometimes she's like, "Shall please have another song now." So,
That's cute. That's very cute. Yeah. So I think distraction is also a great technique. I know my dentist had some goggles, and he actually had some movies that you could watch. I watched like the Pink Panther or something when I had to get like something done in my mouth. So it was a good distraction technique as well. So so people have been talking about their teeth, taping their mouth. So I think people have been using 1-inch wide medical or surgical tape. Joanne writes here. Rhonda writes that there's been some yellow teeth. My teeth have yellowed a lot since I've been taking medications. Have you much experience with teeth discoloration and comments about that, Shafaq?
No, tooth discoloration wouldn't occur. No, it wouldn't occur due to the medication from Parkinson's. It might occur due to not necessarily, no, because the enamel's already formed, and for it to have been affected by medication, it would have had to be given a lot younger, when you were a lot younger. So the discoloration can occur from another number of things. It can be acid erosion, it can be just wear and tear. As we grow older, unfortunately, our teeth do get less white. I'm not going to say yellow, just less white. So it could be, and coffee and tea and stress of, that if we do grind our teeth, that can, things like that can cause it to happen, yellowing or not to happen.
There's been some comments about replacing fillings that may have mercury in them. I know that there was some thoughts about that, and whether the mercury might be causing the Parkinson's. I know from a physician standpoint, we haven't really had any clear guidelines about that. And it's something that I haven't really told my patients to do, because there hasn't been great evidence. But do you have a comment on that, Shafaq?
If you already have silver fillings, I would say leave them be. The stability of the material once it's in situ is brilliant. Okay, the only time it will release any mercury vapor is when it is placed or when it is removed. Whether that's enough to do anything to you, obviously a lot of people think it isn't. That's why it's been deemed a safe material to use. But it's your body, you decide what you want to do with it. But if it's already in situ, I would say leave it be, because it's bound. While it's bound as a compound, it won't release any vapor into your body.
Okay, so it sounds like that's not something that that people are recommending. And I don't think it's worth going through a huge procedure to take this out and put a new bunch of stuff in if there isn't great evidence. So it sounds like that may not be something to pursue. One thing, with entacapone or Comtan, which is this enhancer, it does have like this orangey byproduct. It makes the urine orange. So I don't know if that has, sometimes we've seen certain fluids turn a little bit yellow. So I'm not sure, but I haven't really noticed that with teeth, that it changes to orange or yellow with that medicine. It probably wouldn't deposit there, but that might be the only medicine that I could really think of that might change colors of fluids or things that we give Parkinson's patients. Otherwise, I think it's really the side effects of things that dry the mouth that may affect things. So I think, optimally, one other tip I think that's helpful is if you know that you have good times of day where your medicines are functioning better, if there's a way to get your treatment at that time, it's probably better to go to the dentist and schedule those visits at that time. So.
Sorry, I think I disconnected briefly there.
No worries. Are you back?
I'm back. You were talking about entacapone and how it can cause bodily fluids to turn orangey, but I don't think that would affect the teeth. No. Okay. I did see a question. I don't know who it was from. It was something about whether I have more empathy post-diagnosis for those with chronic conditions. I think I saw that question. I wanted to just answer that.
Yeah.
My father has actually been diagnosed with vascular dementia a couple of years ago, and obviously I have Parkinson's disease, and I wouldn't say it gives me. I would like to think I've always been quite, have had a lot of empathy, but it has made me see things. It gives you a unique insight, doesn't it? You actually realize from, like when recently I've been making a denture for a patient with dementia, and he comes in with his wife, who's his carer, and I see the struggle. Struggle is real, because I know, I recognize that struggle because we struggle with my father. And when Parkinson's patients with Parkinson's come in and they're frustrated by, the tremor, or, that sometimes one of my patients has a tongue tremor, and that can be really, really, really difficult to control. I understand it more. So yeah, I guess it has. I don't think I was lacking in empathy before. I think I would like to think I always had a lot of empathy, but yeah, obviously I have more now, but it just gives me a deeper insight into it, and more appreciation for how hard my patients are trying as well sometimes to just come and be seen.
I mean, I think one of the messages that I want to convey, talking about this phobia and like anxiety, is that this is a human experience. I think most of us have suffering in our lives of some sort, and or are very close to people who are suffering. And then even with the anxiety, panic, getting in a headspace of, kind of freak out. All of these things are very, very natural for not just our patients, but even us living, on this earth together. So I think that if you can find somebody that you connect with as a provider that understands, you, and you feel heard and seen, sometimes a lot of the tension and miscommunication can really go away. And when you feel like you can then connect with that person in a human way, they can sort of help you through even, I think, very tough things. So it's really sometimes about just having somebody who's sort of compassionate there with you. Also, sometimes having maybe, Shafaq, what do you think about having like family members in the room? I mean, I can see it as sort of a double-edged sword a little bit. Sometimes it may be not a good thing, depending on how they are, but tell me a little bit about that.
So if it's a family member who's saying, don't worry, it's not going to hurt, it's not going to hurt, I sometimes would rather that they weren't in the room, because they're putting subliminal messages into my patient's mind that I'm going to do something which is going to hurt. I don't like that word being used. But a lot of the time it's actually very useful. So if I am doing hypnosis, or I'm doing IV sedation, I do have the patient's family member or friend in initially, until the patient is in such a state that they're calm and relaxed enough for me to initiate the dental treatment. And then I ask the companion to leave the room and sit in the waiting room. So I actually do think it's good, but sometimes I think it can get in the way if they're wanting to be in on the action too much. Someone sitting quietly holding your hand is one thing, and someone feeding you messages, which might or might not be helpful, well-intentioned, but not always helpful, is different.
Absolutely. Wow. Well, this hour crazy flew by. I can't even tell you. We've had such a great interaction with the gang today as well. Thank you for all the messages. We didn't get to a few specifically about DBS and Embreja. I don't think affects this at all. I think you were talking about customized mouth guards, right? Not just something that you buy, because it sounds like those may not, some of them may actually even be worse if they don't fit you well.
Yes.
I think getting the right stuff. So, but we got to a lot of these. So it sounds like people are taking their teeth seriously. So yes. Hopefully we can get that message out. And I would love to work with you, Shafaq, to maybe work on some guidelines to help dentists and maybe communicate with patients to communicate with their dentist. It might be nice to just have a leaflet or something that we can put out there in the world about some of these things and common misconceptions. And I think just that idea of making the handle a little bit thicker with the putty or something is actually brilliant as well. So so thank you so much for taking the time. I know it's the evening.
Thank you for having me. I feel like this hour is flown. I don't feel like I've done justice to all that you want. Yeah, I don't know. I hope I've done justice to everything.
Yeah, no. I think we just started. It's a bit of a tip of the iceberg type of topic. So and of course your advocacy and just trying to get the word out about, changing that image of who gets Parkinson's is just also so important. And the Spanish gang is saying they're going to translate this into Spanish as well, or maybe the leaflet. I don't know. we have a women's group in Spain that does some amazing advocacy too. So great to see you, Shafaq, and thank you. And we'll continue to work together on this important topics.
I hope so. Thank you. It's been lovely. Thank you for having me.
Yes. And I loved what you said, that the mouth is the gateway to the body.
I'm going to send it back
that down. I love that. We have to remember our teeth. So it was wonderful. All of the questions, great job, everyone. And this was fascinating. Who knew that we would, the hour would go by so quickly. I invite everyone who's had their camera off to turn it on for a little eye contact, gratitude wave, just to express our appreciation for Shafaq and Indu, and for all of you for the great questions and comments. So Shafaq, scroll through, see all the happy people, maybe with their bright smiles.
Thank you, everybody.
Lovely. Thank you
much.
so much for joining us.
It's been my pleasure. It's been my pleasure.